Hello, good morning friends. Myself Dr. Kumar, consultant pediatrician and neonatologist, and continuing in with our previous video of general examination. Today we are going to deal with another topic of general examination, that is icterus. So what is icterus? Icterus is the yellowish discoloration of the skin and mucous membrane and conjunctiva seen in a patient of jaundice due to excessive accumulation of bile pigment in blood. This bile pigment is generally bilirubin. So at what value of serum bilirubin jaundice usually becomes apparent clinically as icterus? So this is an important question. So for older children, it is more than 2 milligram per dl, and in neonates, the serum bilirubin values should be more than 5 milligram per deciliter to manifest as icterus. Then coming to what are the points of caution in examining icterus. So icterus is best examined in presence of daylight. So ensure that where you are going to examine your patient, there should be presence of daylight. Avoid yellow colored curtain around the area of examination, because the reflection of yellow colored curtain may falsely interpret your finding. Where to look for icterus? So the usual sites to look for icterus are sclera or upper bulbar conjunctiva, then hard palate, under surface of tongue, tip of nose, and palms and soles. So especially in neonates. So these are the usual sites. So sometimes the examiner asks that what are the sites. So most children, most students answer sclera, and after that they do not tell the other points. So these are the main points, that is sclera, palate, under surface of tongue, tip of nose, and palms and soles. For sclera, you have to ask the patient to look down at his feet or fingers, and you gently push both eyelids upside. I have shown one picture in the coming slides. Then for palate, gently ask the patient to open his mouth and you can look at the palate. For under surface of tongue, you have to ask to fold the tongue in backward direction and you can see the under surface of tongue. Then tip of the nose, especially in children, it is visible, and palms and sole again for neonates you can see with your eyes. Then coming to see, these are the pictures for a neonate with jaundice. The whole skin is having icterus. You can also see in palms and soles. So is the color of the nose of the baby. And in adult, for looking at a sclera, you have to ask the patient. See, the patient is looking downward, and I have gently pulled his upper eyelid upside so that the jaundice is clearly visualized. Then coming to what is the assessment of icterus in a neonate. So press the skin against a bony surface for 5 seconds to blanch the skin and observe the skin color. We do basically this in palms, and there is a Kramer staging on the basis of which you can decide that what is the expected level of hyperbilirubinemia in these children. So neonates. So if the icterus is present up to face and neck only, then the expected bilirubin level may be up to 4 to 6 milligram per dl. And if it is extended up to upper trunk, then the expected bilirubin level would be 6 to 9 milligram per dl. For if it is extended up to lower trunk and thigh, then the expected bilirubin level will be up to 9 to 12 milligram per dl. And if it is extended up to legs, then the expected bilirubin will be about 12 to 15 milligram per dl. And if the icterus is visible even in palms and soles, then it is more than 15 milligram per dl. And in any case, if icterus is manifested in a neonate in palms and sole, it is a clear-cut indication to admit the child in ICU for providing phototherapy. And what is the clue to etiology for jaundice? So if the type of discoloration is lemon yellow tint, the possible etiology is hemolysis, and which points out towards the unconjugated hyperbilirubinemia. And if the type of discoloration is dark yellow or orange tint jaundice, then the possible etiology is of obstructive type, that is direct hyperbilirubinemia. So what is direct hyperbilirubinemia? If the percentage of conjugated bilirubin is more than 20% of the total serum bilirubin level, we call it as direct hyperbilirubinemia. Now coming to what are the differential diagnosis of a case of jaundice. So it is carotenemia due to increased intake of carotene in diet, and it may be due to xanthomatosis where yellow-orange tinge is seen on examination. Then what are the broad category of causes of jaundice? It is prehepatic, hepatic and post-hepatic. Prehepatic mainly includes of hemolytic anemia, and any hemolysis it may be due to ABO incompatibility, RH incompatibility, or certain enzyme deficiencies like G6PD. These are under the prehepatic category. In hepatic category, there is a pathology in hepatocellular area. So the hepatocellular pathology points towards the hepatic causes of jaundice, with in older children or adult may be mainly due to cirrhosis of liver or any infection. And in post-hepatic, the causes are sclerosing cholangitis or bile duct obstruction, or in surgery they say stones in bile duct or CBD. So these are all the causes of jaundice, and you can elaborate the causes in more detail under two broad headings, that is causes of unconjugated hyperbilirubinemia and causes of direct hyperbilirubinemia. And again in category you can classify as infective causes, infiltrative causes, then metabolic causes. So all these things will come in play in the viva of jaundice. So these are all things that are important regarding the examination of icterus. So this is in brief all about icterus. Thank you. If you like this video, share with your friends and colleagues so that they will get help regarding the examination. So these things are basic things, and it is asked in most of the time in UG examination and also sometimes in PG examination, because basic things should be clear to all. Thank you very much for watching this video till end.